and welcome to the AHIBS Alumni Talk series. In this series, we spotlight the inspiring journeys of our graduates and the real world impact they are making. Today's guest is a remarkable individual, Dr. Leong Chew Wei. She's a dedicated medical doctor, a proud MBA alumna of Azman Hashim International Business School, and a passionate advocate for health awareness, particularly in the area of diabetes prevention and management. In this session titled How Dr. Leong Accidentally Became a Healthpreneur While Treating Diabetes, we'll explore how her MBA journey complements her medical career, how she applies both perspectives in her day to day work, and what we can all learn about health, wellness, and leadership. Hello, Dr. Leong.
Hello.
Yeah,
Thank you for
thank
the
you very
warm
much.
welcome.
Thank you very much for joining us today. So let's begin with your personal and professional journey. So, what inspired you as a medical doctor to pursue an MBA?
All right. So when I started my journey in medicine, I never thought that one day I'll be talking about business models, KPIs, and strategic planning. But here I am, being grateful, evolved, and still learning. So today I want to bring all of you along my journey, how I accidentally ended up in business school, how it shaped my perspective as a doctor, and how it led me to become deeply involved in diabetes awareness, one of Malaysia's quietest but deadliest epidemics. So let me take you back a bit. I was working in a heart center in the northern region. Every day it felt like a race, patients in, patients out, ECG, medications, rounds, repeat and repeat at the same, and yet the same problems kept repeating. But here's the twist. It wasn't always about the medicine. It was about the system. The long waiting times, patient overload, the staff burnout, and the classic Malaysian move. Everyone pointing fingers, but no one is taking the ownership. That's when I had this moment. You know what? Medications or Panadols can't fix this. So what I needed more wasn't just a clinical knowledge. I needed a new lens, a new perspective, which is called a business lens, a way to understand the system, not just the symptoms. So I did what any overworked caffeine overdose doctor would do. I enrolled in the AHIBS MBA program, and that decision changed everything.
That's great to hear, Doctor. So, how did it feel stepping into a business school environment coming from, clinical practices? So, how does it feel actually?
So let's just say the culture shock is real. So the 1 week I was diagnosing chest pain and interpreting ECGs, and the next I found myself Googling what is balance sheet in simple terms. Luckily, I was in the same class with batchmates who were also doctors, and guess what? They didn't know what it was either. So we struggled together and laughed throughout the whole confusion. But soon I realized something comforting. Doctors and business students actually have a lot in common. We both panic during group projects. We both survive on caffeine. And occasionally, we both fake confidence until the assignment is done. And through it all, I started to appreciate a whole new set of skills, things we were never taught in medical school, like how to read a profit and loss statement, how to politely disagree with a teammate's terrible PowerPoint design. It was uncomfortable at first, but also exciting because I was just wasn't just learning about theory. I was learning a completely new way to think.
I see. So, while you're studying for your MBA, you are also practicing as a doctor at the same time, is it?
Yeah, correct.
All right. So, what were some of the challenges in balancing your studies with your medical responsibilities all together at the same time?
All right, so imagine before I resigned from KKM in August 2023, it was clinic till 6 p.m., on call overnight, then rushing into 8 p.m. Zoom class with our financial ratios while replying to WhatsApp from everyone. And at some point, I wasn't even sure if I was doing an MBA or a life marathon. So the multitasking was so hectic, doctor by day, then MBA student by night. So occasionally zombie by morning. So balancing the work, night calls, and group assignments wasn't easy, but it taught me time management at another level and gave me a whole new worldview. So one major shift was learning to see patients not just as individuals, but as part of a system, one where leadership, policy, and business mattered deeply. Of course, there were nights when I stayed at my screen and I thought, why did I do this to myself? Right. So sleep became a luxury, but I adapted through the strict prioritization caffeine, a healthy dose of regret, reflection combos, and incredibly supportive teammates. And now I'm looking back, every sleepless weekend was an investment, not just in knowledge, but in thinking differently.
That's really an awesome way of thinking it. So let's now talk about how business education fits into a healthcare setting. So in what ways has the MBA basically equipped you with new tools or perspectives as a doctor?
All right, so in medical, we have X-ray, but in here, it gave me what I call a strategic X-ray vision. So before the MBA, I saw individual patients. But now I see system. I no longer see just patients, I see processes, I see patterns. I started diagnosing where things break down, whether is it in operation, communication, or even budgeting. So instead of just saying this clinic queue is too long, now I ask, what's the root cause? Where's the bottleneck? Can we solve it smarter? And that's what the MBA did. It didn't just give me answers, but it trained me to ask the better questions.
I see. So have you found any like a business or leadership concepts particularly like helpful in improving patient care, workflow, or healthcare service delivery?
Definitely. And surprisingly, a lot of them came from the communication and marketing modules. I started a clinic educational website and created a health education board with a simple ideas for my AR2. But they completely changed how patients interact with the health information. So instead of just like dumping the pamphlets, we made things visual and relatable. Suddenly now patients were actually reading. I also use what I learned about workflow mapping to relook at our clinic's flow, how to reduce the waiting times, improve patients' experience at the clinic, and even track the medication usage to reduce the wastage. So all of that came from the MBA lessons. They were not just assignments, so they turned into our real world practice, and these little changes brought a big impact.
Wow, that was like a really great changes that you have done, basically like creating the website and many other things. So, would you recommend an MBA to other healthcare professionals looking to strengthen their roles? Would you suggest to them?
Yeah, absolutely. You don't need to give up your clinical identity. You just need to add new superpowers, which is your new perspective and sharper thinking. So the MBA gave me tools I didn't even know I was missing, like leadership, communication, and most important, financial awareness. So it gave me the business language to speak up in meetings, not just nod along and yes sir, and the confidence to propose ideas and not just follow SOP. Most importantly, it helped me to understand how to run patient-centered care more efficiently without burning everyone out. And yes, I finally understand where the hospital budget actually goes. Yeah.
All right. So now let's focus on a health topic that is very close to your heart, which is diabetes. So based on International Diabetes Federation, as of 2024, approximately 21.1% of Malaysian adults are living with diabetes. So totaling around 4.75 million individuals. So why do you think diabetes is such a pressing health issue today, especially in Malaysia?
Yes, that's a very good question. Because in Malaysia, we have two national hobbies, which is eating, and the second one is ignoring the early symptoms. So basically, our diets are like sugar bombs, with teh tarik, kueh, bubble tea, you name it. We love our food culture, but unfortunately, it's slowly becoming a health hazard. So the rise in diabetes isn't just a statistics. It's something I see in clinic every day. So what makes it worse? Many young professionals ignore the early signs. No?
Ignoring the early signs, is it?
Yeah, correct.
So what are the common and warning signs and symptoms like people often overlook that they might have the signs, but do you think it's just a normal thing to happen?
Yeah, first, feeling tired all the time, going to the toilet more often, feeling thirsty a lot, unexplained weight loss, or wounds that take forever to heal. But do most people notice? No. They blame it on work stress, not enough caffeine, not enough sleep, or just say I'm getting old already. Meanwhile, their sugar levels are flying high. So the truth is, it's not always about stress. It's lifestyles. I once had a 22 years old guy. He looked healthy. He came in saying, "Doctor, I'm just tired." So I looked at his blood profile, blood sugar, and I told him, "Bro, you're taking Milo, Maggi, nasi lemak, and still in denial. And your blood sugar is so high." Yeah, so and you see, so these signs might seem small, but together they are like your body waving the red flags, yeah, just like our background, yeah. So if you are constantly tired and constantly near a toilet, don't wait for your sugar to go full fireworks and all. So get checked early because prevention is much easier than regret.
Yeah, so for the warning signs, like you mentioned, like being tired, of course, it can be related to any other things also, like you mentioned, stress, doctor. So how can an individual like differentiate is the sign is related to diabetes or stress or just a simple maybe headache? So how we can actually differentiate this, doctor?
Yeah, so it's very easy. Just go for your annual blood screening routine. And then for the true diagnosis for the diabetes, you just need to search for HbA1c. This is the, what you call that, the markers for your diabetes, whether you have diabetes or no diabetes.
I see. So, it is always the better choice to, have a medical screening every 6 months or 1 year, doctor. Which do you think is
If this
preferable?
if this is very high or let's say it's alarming rate, I would
Mm-hmm.
prefer to see patients maybe at 3 months and 3 months after lifestyle modifications. They will see every 3 months. Once it's stable, maybe you go 4 months or half year. Once it is stable.
So,
Mm.
if let's say one a person that wanted to change his or her lifestyle into a more healthier way, so what would be the first step that they can take to to initiate the changes?
All right. So first, it's very easy. Just keep it simple, keep it real, and most importantly, make it relatable. So as you can see, nobody wants a boring health lecture, especially after waited outside for, around 30 minutes to 1 hour. So always we can use infographics or short videos and posters to attract them. Yeah. So it's like humor and simplicity. The goal is to get someone to look at the poster and say, "Oh yeah, that's me. And actually they do something about it. Yeah.
All right. So lately, we can see younger patients being diagnosed with diabetes. And what do you think are the emerging trends in based on your clinical experience? So for these lifestyle patterns affecting the risk of diabetes.
Yeah. So actually early onset cases are becoming very alarming concern common. As I told you just now, I'm seeing more young patients even in their 20s and 30s being diagnosed with borderline or full-blown diabetes. And actually, like I said, it's not stress or what, it's not just genetics, it's lifestyle. Sometimes it's a combination. Maybe here 20%, 20%, 20%, with the sedentary habits, high sugar diets, zero movement, poor quality of sleep is a very dangerous combo. And then most of them is like thinking it's just a burnout, but actually it's not, because it's a way their body giving them a very loud, very clear warning. And if they keep brushing it off, they are walking straight into the long-term complications before they even hit 40 years old.
All right. Okay. Thank you, doctor, for like grounding us with the valuable medical insights. So now let's dive into how we can stay ahead with prevention and wellness, especially for in related to the education, right? So how do you basically approach a patient who are like giving public education? So especially making the health advice more relatable and less intimidating, like you mentioned about the the way of approaching them in an easier way through the humor and everything. So maybe you can elaborate us more with this kind of intention.
Yeah. So just tell patients you don't need a very complicated work schedule. Just walk 20 minutes a day. Even it's just from like maybe one end to the other end at the TRX mall. Yeah,
Yeah.
so window shopping also counts. Drink actual water, not just sugar like bubble tea, with all the pearls, yeah. And then also you eat more real food, protein like fish, chicken, more. And also
Mm.
sleep. Because yeah, real sleep, not just like Instagram scrolling until 2 a.m. in the morning. And you don't need to go keto, you don't need to run a marathon. Definitely you don't need a six packs. So you just need to need these habits so that your pancreas can survive So it actually sounds simple, but let's be honest, for busy students and even for us, like the working adults and all, simple doesn't always mean easy because small changes like a daily walk, mindful eating, real rest, if done consistently, it can actually make a big difference because it's not just about being perfect, it's about being consistent.
Right, you're very true on that. So, basically, from your personal experience, doctor, have you conducted any outreach or wellness initiatives that help shifting people's mindset or behavior?
Yeah, correct. So I did before. I did a website for my AR2. Yeah. So you don't need to. So when I did the website for the AR2, all right. So what happened is, as a doctors, we educate, but as MBA graduates, we can amplify that message. So as I told you before, I started the educational website on the diabetes awareness, covering things like how sugar affects your body, how to spot the early signs, and what to eat without crying inside. So I also did a no sugar week challenge for my patients, but obviously there's no medals, no prize, just the glory of surviving 7 days without a teh tarik. But here's the thing, it's not about perfection. Like I said just now, it's about planting that a very small thought. Maybe I can change a little. So that's where the real shift begins.
Understood on that. Actually, I've tried that. Like having myself restricting from having taking any tea or coffee for a certain period of time, and I feel very much happy because I've accomplished something. It's a personal happiness, so I can relate with what you're trying to say actually.
Yeah, that's great. That's great. Keep it up. Keep it up.
Thank you, Doctor. So, all right. So, this has been a very inspiring and informative session. So, before we wrap up, so what final words or advice would you give to our audience, especially to young professionals in medicine or any other field who are passionate about learning, growing, and contributing meaningfully?
So don't box yourself in. You can love medicine and still love the business strategy. So you can treat patients and pitch your business ideas. You can do both. So you don't have to choose. Even though the stethoscope is a powerful, but it's not the only tool. So you have to always explore beyond it. Stay curious, try weird combination, learn what's outside your comfort zone. And to all the doctors out there considering business, don't worry, you won't lose your soul. You will gain perspective. As I said, you'll see system, you speak a new language, and you'll still be healing. So the MBA didn't make me less of a doctor. It made me a better one. I learned to diagnose more than symptoms. So now I diagnose systems. Yeah, so thank you for the opportunity to share my journey. I hope it truly inspires you to take your own steps.
It really does. So thank you very much, Doctor. Thank you for joining us today, for your time and your wisdom. So your words have left a lasting impression as we conclude this meaningful discussion. And to everyone joining us, we hope today's session sparked some ideas on how blending different fields can boost your impact, whether you're in healthcare or beyond. Be sure to stay tuned for more from the AHIBS Alumni Talk series. Up until next time, stay curious, stay healthy, and stay committed to lifelong growth. Thank you. Bye.